Logo and title text, Evidence Now, Advancing Heart Health, an AHRQ initiative. Below the title is the logo of the USA Department of Health and Human Services. Beside it is the logo for AHRQ, Agency for Healthcare Research and Quality. Text. Evaluation and results. Quote, I think we have some definitive evidence that you can provide external support to increase primary care practices quality improvement. Tess Miller, DRPH, Deputy Director of the Center for Evidence and Practice Improvement, AHRQ. David Myers, MD Acting Director, AHRQ.
So what did we learn? We learned that EvidenceNOW worked in its two primary goals. The first is the A, B, C, and S of heart health, the measures of were we delivering the evidence-based care. Was primary care able to do it? The answer was yes. We're still learning what worked and how to make it work better from EvidenceNOW, but the initial findings are really exciting.
Bob McNellis, MPH, PA, Senior Advisor for Primary Care, AHRQ.
So we created a national evaluation, and we used a specific model for doing that, and that was using a grant which allowed the grantee who was doing the evaluation to be independent of AHRQ.
Deb Cohen, PhD Principal Investigator, EvidenceNOW National Evaluation, Oregon Health and Science University.
Really felt like a very big undertaking to us, and we had a very large team. And I think you're nervous at the beginning of every large initiative because what you see before you is sort of a blank page, and how it's all going to work out is as of yet unknown. But through collaboration and partnership and sharing, this sort of abundance mentality, it all turns out okay.
But in order to have a meaningful national evaluation, we need to have similar metrics across all of the grantees. By focusing them all on heart health, and improving the ABCSs of heart health.
A is managing aspirin for folks that need to take aspirin. The second is managing blood pressure. The third is managing cholesterol. And the fourth, which is S, is smoking cessation. We use quantitative methods to assess practice capacities and ABCs at baseline and following the implementation of the intervention. And we use qualitative methods to understand the incredible work that the cooperatives, their facilitators, and their practices did to engage and improve capacity and quality in their own settings.
Tess Miller, DRPH, Deputy Director of the Center for Evidence and Practice Improvement, AHRQ.
Practices participating in EvidenceNOW showed a more than 7% increase in smoking cessation counseling. That's screening all patients if they smoke and counseling smokers to quit. They showed nearly a 2% increase in helping their patients get blood pressure under control. While you could say we only saw an increase of about 2%, you need to consider this increase was at a time when practices that weren't in EvidenceNOW were actually showing a decreased rate. Participating practices also showed over a 4% increase in helping their patients get their cholesterol better managed. And lastly, they showed around a 3% increase in advising high-risk patients to take aspirin. So we saw that you can provide external quality improvement support to increase primary care practices' delivery of heart health services. Change takes time, and even in a short time, we saw improvements happen through EvidenceNOW.
I think we have some definitive evidence that you can provide external support to increase primary care practices quality improvement.
Second thing that EvidenceNOW set out to do was improve the capacity of primary care practices to do quality improvement, their confidence, their skills, the techniques that they were using. And we saw significant improvement in practices all across the country.
So in all of the cooperatives, we saw improvements in the change process capacity score. And in particular, we saw that score improve more in practices that started lower at baseline.
Caitlin Dickinson, MPH Project Manager and Practice Facilitator, Northwest Cooperative Oregon Rural Practice-Based Research Network.
Probably the biggest obstacle for us working with EvidenceNOW was really figuring out how we could produce the data for these clinics. I think another obstacle that we faced with EvidenceNOW was clinics not having the time to do this type of work, and really trying to work with clinics to figure out how they could restructure their clinical day to allow a little bit of wiggle room either in the middle of the day or cushion at the end of the day to prioritize some of the quality improvement work that they were hoping to be able to do.
Stephanie Kirchner, MSPH, RD, Director of Practice Transformation, Southwest Cooperative University of Colorado.
What you do in a clinic, what you do with one family, what you do with one patient can really start to have an effect on the wellness of a community.
As I think some of the research we've done has been really innovative, and I kind of hope that other researchers will take some of the ideas and methodologies that we've used in EvidenceNOW and apply it to their own work.
If you really were to look at how their structure changed or how their team-based approach to care changed, they made dramatic improvement throughout the course of the program. So those were the clinics that I personally was most excited about.
I think one of the most important things we learned is that this model works.
You can provide external support to help small and medium-sized primary care practices improve their capacity to do quality improvement. We did hear from people that learning about quality improvement and how to perhaps deliver care more efficiently, use a clinical team more wisely, it led them to remember why they became clinicians in the first place.
Logo and title text, EvidenceNOW, Advancing Heart Health, an AHRQ initiative. www.ahrq.gov/EvidenceNOW. Below the title is the logo of the USA Department of Health and Human Services. Beside it is the logo for AHRQ, Agency for Healthcare Research and Quality.